Hi, this is Dr. Naidu. Today I wanted to talk to you about capsular contracture and a new research study that I'm doing to help treat this. Capsular contracture is scar tissue that can form around a breast implant. In 95% of cases, when we put a breast implant in, that scar tissue will be very soft. You won't feel it, you won't know it's there, it's not a problem. In about 5% of patients, the scar tissue may become firm, it may become painful, it may distort the appearance of the breast. And in the past, what we've done for those cases is we've gone back to the operating room, removed the implant, removed the scar tissue, and put in new implants. While we still do this, it's very difficult and sometimes expensive for a patient to return to the operating room for this complication, which we can't really predict in most patients. So there have been new methods that have started to research whether or not we can come up with a non-invasive way to treat capsular contracture. One such method which has been developed is something called the ASPS rehabilitation system. This was developed by Tim Wyant, who is a physical therapist in Coral Gables, Florida. And what Mr. Wyant found was that when he used a specific ultrasound machine which he developed in conjunction with specific exercises, massage exercises, and compression wrapping of the breast, he was able to soften the breast gradually over time. So in conjunction with this system, what I have developed is a research protocol in which we are going to use Mr. Wyant's system, his patented system, the ASPS rehabilitation protocol, and we're going to see if this works. So I've obtained approval from both the Food and Drug Administration and the Institutional Review Board of a local hospital, and at this time I'm recruiting patients who are interested in being a part of the study. Right now we're looking for women who are aged 22 years of age or older who have received saline breast implants for cosmetic reasons, and those implants should have been placed above the muscle, not submuscular but subglandular, that is below the breast tissue and above the muscle. This is just the first part of the study, and this is what the FDA specified was the first group that they wanted to look at. We're looking to see if the device is both safe and effective in treating this condition. We also specifically this time want patients who have a grade 3 capsular contracture. What that means is that they have scar tissue of the breast which is distorting the breast or changing the position of the breast, but which is not associated with pain. So it's a very specific group of patients. Right now I'm looking for 10 patients to fulfill that first criteria, and then what we're going to do is we're going to do this protocol, we're going to use the device, we're going to do the massages, we're going to do the compression, and patients will need to see me over a 5-week period 10 times. And after that, they'll see me at the 6-week period after the study protocol is finished, then at 3 months, 6 months, and a year to see if they've been able to sustain their results, to see if their breasts have gone back to where they were before they developed their contracture. So we're very excited about this study. If you think you're a candidate, please give my office a call at 212-452-1230. Or you can go to my website for more information, www.naiduplasticsurgery.com. Please look under the section that's entitled News. That will have information about the study. And if you know someone who's interested or who might be a candidate, please feel free to refer them. At the end of this 1-year period, we're going to be opening up the study to 50 more patients who have either silicone or saline implants which are placed above or below the muscle, but again with grade 3 capsular contracture. Once we progress beyond that, we hope to open up the study to patients with implants of any grade of contracture, both saline and silicone, and either cosmetic or reconstructive, but that will be several years down the road. So we're very excited about this, and I hope that you'll be able to refer someone to get us started on this study. Thanks for listening.